All this week, 10 TV is highlighting why mental health matters. This comes as Columbus police are responding to a mounting number of mental health related calls.
In most cases, people are transported to medical or mental health facilities, but these cases are really complicated.
10 TV's Lindsay Mills looked into a case where a 19-year-old was charged with felonious assault. Lindsay.
Andrew and Yolanda, in this case from March, officers are called to assist workers from Net Care Access. It's a mental health and substance abuse crisis intervention service. The workers told police they needed help taking a 19-year-old in for a mandatory health evaluation. They say he started making threats. Responding officers then immediately call in a crisis intervention trained officer for support. Officers explain they are there to help.
I'm just making sure everybody's safe.
You're taking affirmative action. It's not your choice. You're taking affirmative action.
We don't want to take this to the ground, but that's the next place this is going to go.
The subject says,
"From this angle, I would disrespect you."
And he falls to the ground. That's when you see him start to kick and officers trying to get him under control. They place him in handcuffs. Eventually, they make their way back up, standing, and the subject throws his head at an officer.
You just smashed your head into my head.
At this point, Sergeant Matt Harris is on scene. He oversees the CPD crisis intervention training. The man was arrested and charged with felonious assault. He was taken to jail, and according to the case report, he was refused there and then was transported to OSU Wexner Medical Center. The man's mother reached out to 10 TV, notifying us of the case. She has since not responded to our request for an interview, but told us her son has bipolar disorder, and he was in the hospital for a month after this incident. According to the Franklin County Prosecutor's Office, an investigation remains underway. Columbus police say they cannot talk specifics about this case, as it is an active investigation. It's one example of the thousands of mental health calls police respond to.
That level of anger is not healthy.
In 2018, the CPD Mobile Crisis Response Unit was created, a team of 6 officers paired with trained mental health clinicians to respond to 911 calls for a mental health crisis. Netcare CEO Brian Stroh says the goal is not to stigmatize or criminalize mental illness.
We have seen dramatic reductions in who ends up in jail and why, so I think that's a huge win. And I also think that families have less reticence to call first responders and say, hey, I need help for or with my loved one, when they know that there's a very good odds that that person's going to get the help they need rather than simply go to jail.
We were invited with our cameras to sit in on the latest crisis intervention training to see how they train and prepare for mental health related calls.
Hey, ma'am. Hey, ma'am.
Hey, ma'am.
Netcare social workers act out real scenarios from cases they've responded to before.
Tax day, that's the big day.
Tax day.
Everything's gonna hit at once.
Can you tell me what day that is?
Tuesday, I think?
It's on Tuesday?
At the end of each scenario, they go over what worked and what could have been done differently.
What we're trying to teach is patience and the ability to go with the flow. Our goal is to get people treatment for the illness that they're experiencing, for that crisis situation that they're in the midst of.
Although he couldn't speak about that March 9th case, Sergeant Matt Harris explains what happens after situations that end in an arrest or use of force.
Anytime that there's a scenario that we respond to that doesn't go great, we always talk to each other, and we talk pretty extensively about these situations, and we dive in pretty deep to figure out whether we could have done something better or potentially whether whatever happened was just simply unavoidable.
He says even with crisis intervention training and the Mobile Crisis Response Unit, the need for mental health resources exceeds what they have.
We're sort of in an age where resources are very limited, staffing's limited, but we do the best we can with what we have. In a perfect world, yes, if we had more mobile crisis teams, then we could handle more crisis scenarios.
So, according to CPD records, there were more than 17,000 mental health related calls for service in 2017. That increased to more than 22,000 in 2020. In 2020, MCR units responded to more than 7% of mental health related calls. Crisis intervention trained officers responded to more than 61% of those calls. If you or someone you know needs mental health help, there is another number you can call besides 911. You can call, according to Netcare, 988. It covers suicide prevention and more. It's answered by mental health professionals or well-trained volunteers who can direct people to the help they need.